Back to obesity, we see more adult diseases in children and adolescents like type 2 diabetes, heart disease, hypertension. And then you got to look at the stigma that adolescents are facing who are obese. This talks about a lot of the physical issues, but let's not discount the psychological issues and bullying and, just all around horrible behavior that we see with. Um, Adolescents today. I did include a video on bariatric surgery in adolescence in Blackboard that you can view. All these videos, I think they're less than 2 minutes long, so you're not making a big commitment by viewing those. But there's been some research indicating that it's beneficial to have those surgeries for kids that have some of these comorbidities, like a BMI of greater than 40 with type 2 diabetes and high blood lipids. So that early intervention can help set them up for healthier adulthood. So dietary recommendation for those that have chronic diseases, it's going to follow the same recommendations that we see with adults. We want to make sure that they are getting omega-3 fats, that they are decreasing saturated and trans fats, and then not smoking. And in some instances, those kids may need cholesterol lowering medications. All right, as all of you know, I am the queen of nerdiness and geekiness, so this slide is kind of hard for me to discuss because I'm more of a beer girl. I've never really done any kind of drugs or anything like that. So in the past, I've gotten some help from some forthcoming students in terms of what different drugs are called these days. So your book outlines teen problems that teens may face, like marijuana, ecstasy, drug abuse in general, cocaine. I'm sure there's many more things available to kids now, and I thankfully don't have to worry about that right now with my kids, but you never know. But anyway, marijuana, it says about half of high school students report trying this drug. In terms of their nutrition, they might eat more junk food, cocaine. Many adolescents may use this drug because it replaces hunger. We see often weight loss. This is a common drug in the modeling community because it allows for decreased appetite. Ecstasy, that may also cause weight loss. Drug abuse in general, these kids can be at risk for hepatitis because of shared needles. They're spending their money on drugs and not on food. They could have taste changes or other metabolic issues. And then we'll look at smoking, which can ease the effect of hunger temporarily. And those who smoke, they have lower fiber, lower vitamin A, lower vitamin C, folate, decreased taste sensation, and that's going to go along with smokeless tobacco as well. We've talked in Nutrition for Dietetics and in our pregnancy unit here in Life Cycle about adolescent pregnancy. Remember that term gynecological age. The lower that gynecological age, the greater risk for moms. So the gynecological age of less than 2 years puts mom at greater risk. So gynecological age is the amount of time from the first period to conception. So if mom gets period at 12 and then conceives at 13, that gynecological age is less than 2 years and it is at a risk. Some issues in adolescent pregnancy are listed here. We've talked about those. We want to make sure that pregnant adolescents are getting prenatal care, but also we need to understand that sometimes they don't know that they are pregnant or they're scared of telling someone that they're pregnant, so they might not get prenatal care until late in their pregnancy. So risks associated here with adolescent pregnancy, certainly we have issues with the child in that low birth weight. We have psychosocial issues in that, the mom is more likely to be in a lower socioeconomic group and then continue along that path. And then hazards to infants who are born to adolescents.